Tony, since the so-called Freedom Day, 19th of July, what has changed in our services when it comes to COVID protections?
Actually, nothing in our services. The government guidance says that within registered settings, there's three places where it stipulates wearing PPE, and that's if you do providing direct personal care, you're any other contact within 2 meters of anybody else, and carrying out domestic duties or other activities. And that in reality means that if you're anywhere where there's customers going to be present, then you need to be wearing PPE.
Okay. But community hubs are not a registered setting, so does that make a difference?
Well, actually, there's no guidance for community hubs as such. But when it comes to supported living, the guidance just said, look at the domiciliary guidance and the care home guidance. So we've taken a community hub as a care setting, and that's been agreed with ACS. So we've got standards throughout all our services now.
When it comes to masks, are there any alternatives?
Masks are formal personal protective equipment and form part of a range of control measures, but the government guidance actually states that we have to wear masks, so we've got no leeway on that at all. Cloth face covers are exactly that. They're cloth face covers. They're not masks. When we're talking about personal protective equipment, we're talking about the masks that we provide.
Are masks the only control measure?
Absolutely not, no. Good ventilation is absolutely vital, and good regular hand washing as well as social distancing. So effectively, if you've got two people in a fairly small room and they're wearing a mask all day, there's still some droplets of air coming from the sides of the mask. They're not airtight, so we still need to have good ventilation. You can still contaminate things by touching or sneezing or coughing. So hand washing, absolutely vital. Good ventilation, totally vital. And you make sure you social distance whenever you can.
But what about masks in offices then?
Well, if you're alone in an office, you don't need to wear a mask because there's nobody else about. So that's absolutely fine. But you've got to consider that if you're not the only person using that office, you need to sanitize. If somebody's going to be coming in and out of that office, you've got to consider what other control measures you might have to have in place.
And what if I need to leave the office?
Well, the guidance states if you go into an area that's frequented by staff or customer-facing staff or customers, you need to have a mask on. So if you leave an office and you go into a communal area, you've got to have a mask on there.
So, but with the mask, can I then reuse the same mask? Is that okay?
No, absolutely not. If you've worn a mask, these are single-use masks, and because we're working under the PPE at work regulations, we have to follow our manufacturer's instructions. So these are single-use masks, absolutely. But there's another reason for that as well. It's not just a bureaucratic thing. When we've been talking with public health, they've confirmed that a lot of the outbreaks they've seen is because people are reusing masks. So they're coming into an office, they're sitting down, they're taking the mask off, putting it down on a contaminated surface, and then putting it back on again. And that's how a lot of people are getting infected.
What about when I'm alone in the office, quite happy, doing my work, and then somebody walks in to ask me a question or to share some information? What then?
Don't panic.
Okay.
Absolutely, don't panic. I have seen people panic. If somebody stood by the doorway and they've suddenly hurriedly put a mask on, there's no need to. As long as you've got good ventilation and they're 2 meters away and they're wearing a mask as well, then you're just a few minutes talking and then that's fine. Keep your distance, keep the ventilation. You don't need to worry about it.
So why then do we need to wear masks if there are two of us in an office?
Well, it comes back to the control measures. The more control measures you have, the better, because every control measure has a slight imperfection in it. So if you're wearing PPE in an office, and we can wear PPE officially because we're a care company. If you're wearing a PPE in an office, you cannot become a close contact. So if the person you're working with test positive, you've both been wearing the correct masks, you can still carry on work. You don't need to self-isolate. Also, in day services, it's likely that you're going to be coming into contact with customers at some point. Even though it might not be a customer area, we know that customers walk into offices to say hello sometimes.
I mean, the thing is with all of this, like it does mean that we end up getting through an awful lot of PPE during the day. There's a lot of waste. What should we do about that?
And that's a good question. And there will be an element of additional waste on this pandemic. But all we can do is plan your day. And it's difficult for us because we're used to having drinks and meals with our customers, and we can't do that now. So you've got to plan your breaks, and you can wear a mask for a session, which means when you start, you can keep going until it's break time, and then you can take it off. But make sure you remove yourself from the customer and have your breaks in that times. You've got to plan it with your colleagues again, because it's not something we normally do. You plan it with your colleagues, just as though you would if you would do just have a cigarette break. Make sure everything's covered. Nobody's going to have an issue, but in this hot weather, you've really got to make sure you drink plenty.
Okay.
And don't forget to dispose your mask before you break. And put a new one on when you come back.
Somebody I know went to hospital for a visit, and the doctor raised and lowered their mask. So if the doctor can do it, surely, what is the big deal? It must be okay if a doctor can do it.
And that you can see that point, but I did actually follow this up with an infection control nurse, and the infection control nurse wasn't very happy, to be perfectly honest, because they don't want their professionals lowering the mask. It gives the wrong impression. Well, it happens sometimes, but just because they do it, we doesn't mean we should do it. We're also professionals, So in your job, you keep it in place as the guidance has shown, and then we won't have any outbreaks.
Is PPE required when our customers don't have any symptoms of COVID-19?
Yes, absolutely. As there's a sustained transmission of COVID, we recommend PPE use regardless of whether the customer's got symptoms or not, because an awful lot of people have got COVID-19 without symptoms, and we don't want it being passed on to people who are particularly vulnerable.
How does PPE protect me?
Well, first of all, the main thing is masks. We're wearing masks all the time. That prevents you from inhaling any droplets, and it also reduces the amount of droplets you exhale because they're caught in the mask. Doesn't stop them completely. We're not talking about respirators here. We're talking about fluid repellent surgical masks, and that's what they are. And wearing those all the time reduces that transmission of droplets, which is the main way of catching COVID-19. Gloves we use, and if we're doing any personal care, guidance says if we come into contact with any bodily fluids from a customer, or we're touching a customer, we have to wear gloves, and that stops any contact transmission from infected surfaces or infected bodily fluids. Disposable aprons, same thing. It stops the contact getting onto your clothes. If we stop the transmission to your clothes, that therefore stops the transmission from you to anybody else. We also have eye protection, and this is very much a customer specific eye protection. If we're doing any aerosol generated procedures, which we don't tend to within Leading Lives anyway, but if we've got any, if we're bathing somebody and there's a potential of bodily fluids being transmitted in the water, then you need to wear eye protection, and that just stops the droplets getting into your eyes and contaminating you that way.
Do I need to do anything else to protect myself and others apart from wearing PPE?
Absolutely. PPE comes way down the list of control measures when it comes to protecting from hazards, COVID-19 being the hazard in this case, and hand hygiene. We're touching things all the time, so washing your hands regularly. Washing your hands is better than alcohol gel, and certainly alcohol gel, don't use it if your hands are physically dirty, because you've got to. All you're doing is decontaminating dirt. So you need to, you only use hand gel if your hands are physically clean. Respiratory hygiene. So this is stop touching your face with your hands, which is hard to do. I don't know how many times I've done it during this video, but it's a hard thing to do. And then following the standard infection control procedures within your service. So your service will have a list of what needs to be cleaned down and when. Follow the hand hygiene immediately before you do any care, immediately before you take your mask off, and after you put on your mask back on. Okay. So hand hygiene, don't touch your face, follow the standard protection, infection control procedures, and make sure there's ventilation.
When can I reuse PPE?
Most items are uh, single use only. If you've got glasses or a visor, they can be reused, can be cleaned and decontaminated successfully. But masks, absolutely not. Do not reuse a mask. Gloves and apron are always single use anyway. So we should be very used to wearing gloves and aprons for doing personal care. That's always single use. But nothing else effectively we've got that's reusable.
What is a risk assessment and who is it that does these?
Well, a risk assessment in general it assesses, it identifies the hazard. In this case, we're talking about COVID-19 as the hazard, and it identifies the likelihood of being infected by COVID-19 and then the severity of what might happen if you're infected. And our risk assessments, we have somebody who's shielding is a high risk or the highest severity if they get it. Somebody who's really young and healthy, we've got quite a low severity there. So we have to manage the likelihood then, and that's where we put the control measures in place. So we've got two types of risk assessment. We've got the all support risk assessment, which details what you need to do when you're supporting somebody with care. And this could be personal care, intimate personal care, or helping them paint a picture. You're doing hand-over-hand support. It covers those areas. And then we have the building risk assessments. And these are the legal requirement that says we have to be COVID secure. And you'll see the little blue signs in your buildings to say that we're COVID secure. And those are specific to the building, and your service managers would have gone through room by room with some support from myself to say what we're doing here, where are people sitting, how many people can be in this room at any one time, where do we put the hand hygiene, which windows do we have open, all that type of thing. And they've got to be reviewed on a regular basis because customers change in and out. If we have some extremely critically vulnerable customers coming in, the risk assessment might need to be considered for them as well. And who does them? You get involved in them. Everybody can be involved in the risk assessment because your staff at all levels have got a different view on what works and what doesn't. So the service manager is ultimately responsible for getting them done, but everybody can be involved in doing them.
How will I know if any of my customers are shielding or are clinically extremely vulnerable from COVID-19? And what do I need to do specifically for those customers?
Okay, well, individuals with certain types of health conditions, some types of cancer, lung diseases, suppressed immune systems, and fairly soon into COVID, they started to include people with learning disabilities in that. So people with Down syndrome, for example, were classified as extremely clinically vulnerable. The same considerations need to be done for anybody that's clinically vulnerable, and that's an individual risk assessment for them coming into that service. Anybody that's clinically vulnerable, we have to have masks, gloves and apron on when we're within close contact to them at all times. But equally, they might want to go and speak to their friends. And there's a management process there that has got to take place, taking into account their choices, but also highlighting the risks. So it's very much customer specific on that one. It's got to be very much person-centered care.
If I wear PPE, what should I do about cleaning my clothes at the end of my shift?
Okay, regardless of wearing PPE, at the end of your shift, you need to clean your clothes. If you've been supporting somebody who isn't COVID positive, then you can wash those with your normal washing. That makes no odds. If you've been supporting somebody who is tested COVID positive, you've got to wash them separately in a half load at the maximum capacity possible. But what we do say about wearing clothes, if you have to go into a different service, we ask you to put a different change of clothes on. So there's no risk of contaminating between services.
Okay, so if I'm going from one hub and then I'm going maybe into a supported living setting in the same day, in the same shift, I'd change clothes in between.
Absolutely. Now that's quite rare now. It should be quite rare because we're trying not to share staff between services. But we do have some staff. We know who they are and where they are, who work at different companies. That can all be done and can all be managed but we have to know about it, and we have to make sure it's all done correctly.
What should I do if I get pinged?
Okay, there's been a lot of talk about this in the news, and quite a lot of misinformation, to be perfectly honest. If you get pinged, you need to stay at home and isolate and call your manager.
But what about if that's going to cause a really big problem in the service? There's nobody to support. I don't have any symptoms and so on. I mean, can't I come in and work? My lateral flow test has come back negative.
Potentially you could, but that's not your decision. In fact, partly that's not our decision either. We've got to get permission from ACS to do that. There is an exemption process that we go through, but the first thing you have to do is isolate and call your manager. But the exemption process is Leading Lives need to confirm that the service needs you back, and we can't get staff from somewhere else. So the service has got to be at an unsafe level, otherwise we can't apply for a exemption. Secondly, you must be double vaccinated, and the second vaccination has to be within 14 days of when you get pinged. Because if you're not double vaccinated, you can't come back in. That's not allowed. And then you must still isolate until you get a negative PCR test. So you've still got a few days, so you can't come straight back into it. You've got a negative PCR test, and you need to do a lateral flow test for the rest of the isolation. Now, having said all that, we then need to get agreement from ACS. So we ask specifically, case by case, can this person come back? And after all that, when you do come back, you have to agree to only leave your house to travel to and from work. So it doesn't give you freedom to go everywhere else. So yeah, it is possible to come back to work if you've been pinged, but it's not easy and it's not straightforward.
Is there anything else that you think we need to know to stay safe, to continue to stay safe during this period where Freedom Day has apparently happened and everybody is out and about?
Well, we've seen a lot of stuff in the news, and that's all general information. It goes for everybody. In care, we are specifically in care, we have to do certain things. So regardless of what we hear on the news, regardless of what we see anywhere else, Leading Lives have got these policies and procedures in place we have to follow. You might see people on the telly in care settings with a mask under the chin. We can't allow that. That's their problem if they do that. We don't do that. And we've had 0 outbreaks in the last 17, 18 months. So if we carry on doing what we're doing, do what our policies say, and then we're going to be fine.
Thank you. That's really helpful and informative. I feel I know a lot more now about what I should be doing and where. So thank you very much, Tony. And hopefully we'll all continue to stay safe and not have any outbreaks as we move into this next period with this terrible pandemic. Thank you.
Thank you very much for your time, Gemma. Take care.
No problem. Thanks. Bye-bye.